Welcome to the Quality Improvement Induction presentation. Today we are hoping to give you a brief overview of what quality improvement is, why and who it's important for, what it means to you as an individual, in your team or service that you work for, your wider directorate, and finally to our trust as a whole. So let's introduce you to the Trust's Quality Improvement team. Our Associate Director of Quality Improvement is Luke Bornber. He has a background as a probation officer and has worked for the organisation for a number of years now. We have our QI lead, Charlotte Wood, who started off her quality improvement career in industry, then moved on into healthcare for a number of years now. We then have Wendy Walder, our project support officer, who has worked within the organisation for a number of years now and in many administrative and supportive roles. We then have Laura Shipman, who is our quality improvement apprentice, who supports the team with effective administrative skills. Then we move on to our quality improvement facilitators. We have Karen Hurst, who has a background as a district nurse by trade. We then have myself, Steve Dakin. I have a background as a mental health nurse, working mainly in inpatient adult mental health services for the organisation for a number of years. We then have Liz Gethings, who's a podiatrist by trade and has worked within the quality improvement field for a number of years now. And then finally we have Matt Horworth, who is also a mental health nurse by trade, mainly working in rehabilitation and the crisis team roles. Our vision here at Nottinghamshire Healthcare NHS Foundation Trust is that we will have an embedded culture of continuous improvement. We think there are 4 aspects which are going to help us to achieve this vision. To engage. We want to engage with everybody across the organisation and let them know, whatever role they're in, quality improvement is important to them. We attend events such as the preceptorship events, board events, and we get the word out of what quality improvement is. We want to build a capable workforce, build on people's existing skills, realising that you've been doing it already, but we just want to give you some structure in what you already knew. We want to support. We support over 100 projects across the entire trust who all have an aim to make things better for the patients and carers that they serve and give some tools and techniques to help make complex things a little easier. Finally, we want to embed. We want to make things quality improvement wise become an everyday action. And by doing the first 3 things well, we would embed the skills, enthusiasm and a culture of continuous quality improvement, which will hopefully help us achieve excellent services across the organisation. What is quality improvement? We think that there are 4 key principles to it, that it's staff-led. You know your patients and carers and services best. You will know what works well for you and them, and also what needs improving. It's patient-centred. It goes without saying, but the patient is at the heart of all what we do within this organisation. If you involve them in your projects, it means that you can learn from them what they think is good and also what they think needs improving. Focused on measurement. Focusing on measurement means that you will know that if things are better or if there have been improvements. So both in a quantitative and a qualitative sense, how do you know something has made an improvement? So through numbers or through a narrative or a story. And finally, having a consistent methodology. So across the organisation, if everyone is using the same tools and techniques, it becomes easier to share and learn from each other. Also, on a wider front in Nottinghamshire, we currently work with an integrated care system, an ICS. And alongside Nottingham University Hospitals, Sherwood Forest Hospitals and City Care, we are training up our staff to use the same methodology. So consistently, whoever you are in Nottinghamshire, we improve things using the same tools and techniques. It's called the model for improvement. The first question is, what are we trying to accomplish? If we think about our aim at the beginning of our project, then we will know when things are better and have improved, rather than just doing things for the sake of it. The second question is, how will we know that a change is an improvement? This goes back to our measurement side of things. If through qualitative and quantitative measurements we can show where things are better or improved, This is key. The third question is, what change can we then make that will result in an improvement? If we come up with lots of different new ideas and ways of doing things, we can then select these and test these out. This is done through what's called a PDSA cycle. So we plan what we're going to do. We choose our change idea. We do it. We then study our results, and then we act upon our results. Finally, we want to go through a project management structure. So we identify the quality issue, we understand the problem, we think about our change ideas, we test them out and then implement and sustain them. It comes in the form of bronze, silver and gold award. Our bronze award training here is a 2-hour light touch of what quality improvement is. Some simple tools and techniques to use and help you steer quality improvement projects. We've delivered this within our corporate services and then out and about within our clinical area services, in our forensic directorate, our specialist services and local partnerships. We come to you and deliver training to your needs. Share your ideas when you're at work. Discuss with your line manager in supervision. Contact the QI team to run something past us. We've got an idea here in our team. Could you come and help us with it? Finally, access our training. We'll come to you as a team, or you could always drop onto one of our trust-wide training events. So here's how to contact us. Here's our email address and telephone number. We're also prevalent on Twitter, so give us a follow. We like to share our successes of projects going across the organisation here. Finally, help us to make Notts Healthcare Foundation Trust a place where you can make a difference to patients and carers through continuous quality improvement. Thank you.